There's a question over there, I think.
Yeah, I was just going to say, I mean...
Yeah, sorry, just behind you.
Sorry.
Yeah.
Carly from the Herald. A year ago, last June in fact, from when you said that this was unusual territory, uncharted waters, you yourself, Jim, said 34 years you've never experienced anything like this. Do you still feel the same?
Yeah, I mean, I think I've said yes. Yeah, and it's 36 years.
I think Carl, I think we'd all say that it's unprecedented, and not just from a professional sense, but from a personal sense as parents and with family and communities. This resonates far beyond city boundaries, and we can understand the wider concerns that would be for the community, parents with children in nursery settings.
So one more question to that. If you had a message to all parents who have children in nurseries or are thinking about children in nurseries, what would you say to them? What key point would you say?
I think if I start with that, I think there needs to be a very clear understanding of how the nursery setting is run, of the procedures in place around staff training and recruitment that have been mentioned in the report. The report is very specific in relation to the areas that parents would need to better understand as part of that relationship.
Could I add a comment, Jim? Because I think this is absolutely fundamental. You might recall that at an earlier press conference we talked about parents saying to us, we're just understanding now that we didn't really know what good looked like. And so one of the things that we have worked very hard at in the local authority and with the Early Years Partnership is making sure we get out good leaflets and information to parents that give them advice about what to look for and how you make judgments about what good does look like. Early years settings have had advice and training about how to make much more information available to parents. And as Andy has said, it really is about finding out as much information as possible about the nature of the nursery, how it's run, what you can expect as information as a parent from them, and how your child will be cared for. Ask lots of questions. There are never any stupid questions from parents in respect of the daycare and education of their child.
Well, while you're talking about parents, Ron, how were they coping last night, and how do you continue to support them in the future? Because this doesn't go away easily, this, does it?
As you'd expect, there's a wide range of emotions that they're feeling. Jim has talked about their anger and frustration still, but actually a huge resilience and strength. They are so impressive as individuals and as a group. We continue to support them according to their individual needs. For some parents, they've said, I just want to get on with my life. I don't want my child to know about this or to be a victim. But for others, it has been something that they've found emotionally very hard to deal with. And we've put in place whatever support and advice they've asked for and whatever emotional support that they've asked for. I don't know if Paul, from the health perspective, you'd like to comment.
I think just particularly to understand that it's on their terms. So the offer that was made last night was for further peer support, facilitated group or individual conversations, but the onus is really back on the parents to take it up on their terms according to their needs. It would be wrong for us to generalise the feelings of parents, as has already been said. There's a wide spectrum of needs.
Has there been any response from either the nursery or former members of staff at the nursery to this report?
Members of staff were obviously interviewed during the compilation of the report, and they have had some briefing on the early findings of the report. I'm not privy to their reaction, and I don't know if anybody else would not have that back yet.
And the nursery, of course, closed immediately after the incident came to light, so the nursery has ceased to function, so the nursery as a body has not been able to respond.